This is One on One. We're here at the New Jersey Nurses Association. These are the EPIC Awards. Some pretty special people and organizations being honored, including Claudia Marchese, Executive Director of Catastrophic Illness and Children Relief Fund in the state of New Jersey. What is the fund and why is it so important?
The fund, we are a New Jersey state agency. By legislation, we help New Jersey families, middle-class families mostly, with our overwhelming uncovered medical bills for their children. Any family in the state, no matter what their income is, if their medical bills for their child in any given year are more than 10% of their income, they can come to us for help. We can pay off their debt, or we can reimburse them for what they put out. We help families with
People don't even know about this very often.
That's why we're here. That's why I want to get the word out. So I'm so happy that they're recognizing us, and I work on this every day, getting the word out. We cover things that no insurance covers, like a modified van or modifications to home for accessibility, and then we cover everything that insurance has done all that they can. So there's co-pays, deductibles, it's a lot. No matter what the child's diagnosis is, we're here to help.
So the state of New Jersey committed to helping these families. The word has to get out about it. But the role of nurses are so important, right?
Absolutely. My marketing philosophy is to influence the influencers, and to me the nurses are on the front line with the families. They're the ones. So a family who's not having illness issues with their child, it doesn't sink in, they don't hear it, they're not going to retain that we're out there as a resource. But nurses are out there meeting families every day, and if they're aware of what we do, they can help us find those families that would be eligible and need our assistance.
How do families find you right now?
Oh, there's so many ways. I mean, they find out often from their providers, from their school nurses, from our commercials on
JTV?
Yes, we have radio spots, and we have some commercials also on other stations. And I'm out there every day talking to all the influencers. We talk to the mayors, the legislators, the pediatricians. So we're always interacting with those people who can reach the families.
The website is?
njcatastrophicfund.org.
The final word to everyone watching right now who says, I don't think that will ever happen to me. I bet a lot of families say that.
So many families, I mean, there are children who are born with illnesses, but we have accidents every day. It could be as simple as a broken arm. If you don't have insurance when it happens, then you're overwhelmed with the bills. And we have kids of every age, every socioeconomic, who something can happen to at any time. And even with insurance, many people with insurance still find that they have a need for our program.
Congratulations on your award tonight.
Thank you so much, Stephen.
Thank you for all the work you do.
You're very welcome.
We're here with Dr. Mehrotra, and the name of your foundation is?
It's the SKN Foundation.
Which stands for?
Sri Krishna Nidhi Foundation.
Explain it. What kind of work do you do and who do you serve?
We serve our local community, especially the minority community, in trying to educate them and improve their total well-being through that education that we do.
Describe this community and describe what would happen if your foundation wasn't there.
Well, I would hope that some other foundation would step in and do the work, but what we do is we try to empower the community in terms of how to take care of themselves. So we might have programs like Move It to Lose It, which focuses in childhood obesity and goes in the after-school program. We have something called the SCOPE program, which is the Special Needs Community Outreach Program for Empowerment. So helping families in trying to take care of themselves and how they can be a better part of society.
Talk about a night like this with the Nurses Association and why it's important.
It is an honor for us to be here and to be recognized for the work that we do. And it really gives us a boost of making sure that we are doing what we think that the community needs. So being recognized, I think, is the best part.
So being one of these EPIC awardees is a big deal, isn't it?
It is a huge deal, and especially to be standing here talking to you is an even bigger deal.
Well, we represent everyone in public broadcasting.
So it is a great honor to be here on the same platform with some of the great EPIC awardees out here.
Congratulations, Doctor.
Thank you so much.
Hi, Steve Adubato. We're here at the New Jersey Nurses Association. This is the EPIC Awards. Some pretty special people are being honored. The gentleman you're about to see on camera, he's Kevin Rendino, chairman of the Partners for Health Foundation Board of Trustees and an EPIC awardee. Congratulations.
And to you as well.
Yeah, I try not to draw attention to that. I will get that rose, and it's not me that is being honored. It's our production team at the Caucus Educational Corporation and our partners in public broadcasting. But Kevin, let me ask you, talk about the work of your organization. What exactly do you do?
Well, our vision is to promote healthy and better living for the 15 communities that we serve around certain areas: mental health, dental health, homeless and hunger, and aging in place. as well as providing scholarships for nurses.
Let's talk about those scholarships for nurses. It's so important. Why?
Well, nurses have always been the backbone for health services in all our communities, whether it's in schools, in hospitals, visiting nurses in our communities. The system doesn't work without nurses. And so for Partners for Health, over the last 7 years, since 2008, we've awarded nearly $1 million in scholarships to 450 students that went through the Mountainside Hospital Nursing School. And we're pretty proud of that.
You know, actually, last year we partnered with Partners for Health, the Homelessness Initiative, in connection with the Montclair Film Festival, the film Richard Gere put out dealing with homelessness. Talk about why that initiative is so important.
You know, we live in an affluent area in many of the communities that we serve, and yet there is an underpinning of need, both in homelessness and in hunger. For example, in hunger, whether it's the Human Needs Food Pantry or Tony's Kitchen in Montclair, we do a matching grants program at the end of every year. Every dollar that they raise at the end of the year in their campaign, we match. We raised over $200,000. So that's a good news, bad news situation. It's good news that we're able to raise the money for the food pantries. It's bad news that there's such substantial need because we have a lot of people in our communities that are either hungry or homeless, and we need to fix that.
How did someone like you, and with your background, I mean, you're involved in finance and business, get involved in a foundation like this?
Wanted to give back. Dr. Sorger, the late Dr. Marty Sorger, had asked me, who was on the Partners for Health board, asked me if I wanted to go to breakfast, and the next thing you knew, I was on the finance committee, and then 2 years later, they asked me to become chair. And it's a great organization. It's giving back to the communities. We're all lucky to have the lives that we have, and we certainly need to give back, and this organization gives back in a lot of ways. This award for me tonight is not an award for me. It's really an award for Partners for Health. And we all get a lot of psychic income for all the good work that we do.
Finally, let's talk about the role of nurses. How important are nurses, particularly post the Affordable Care Act?
Really, really, really important. And for example, Mountainside Hospital is actually closing its nursing school. And that's a problem because the demand for nurses is even greater than it used to be. That's why we are going to start a new scholarship program towards the end of this year where we're going to continue what we've been doing over the last 7-8 years, and we're going to extend that to other communities. So Bloomfield College, Caldwell University, there's students there that are needing and deserving of scholarships. And
they have big nursing programs.
They do have big nursing programs. So all the work that we've done in the past for Mountainside Hospital, we're going to start moving towards Bloomfield College and Caldwell University, and we're really, really excited about that because, as I said before, system doesn't work without nurses. We've all been in hospitals, we've all been in doctors' offices, and nurses make you feel good, and they're the caretakers and the givers, and it doesn't work without them.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, TD Bank, the New Jersey State Nurses Association, and the Institute for Nurses, the Healthcare Foundation of New Jersey, the Give Something Back Foundation, and by Cone Resnick. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.